Hi, Sakis News Planet. We're going to talk about hepatitis A, and concerned that only 80% of, I believe, America is vaccinated for this concern, and it's concerning. So we have with us Dr. Lee Smith, pharmacist and vaccine educator at GSK, and we have Stan. Good morning. Hi, how are you both?
Good morning. Doing well, thank you.
Maybe.
Good morning. Doing
I'm
great.
crazy about pharmacists. I ask them 100 questions.
Well, I'll be ready.
They have consultation. They have consultation areas in you know, even the chain stores. I think because
Right.
many people do. So my question is, what is hepatitis A?
Yeah, thank you for that.
People get it?
So hepatitis A is a very contagious viral infection that impacts the liver. It can lead to sickness, hospitalization, and in rare cases, even death. And when I talk to people who contract hepatitis A, will require hospitalization. It's usually a short-term illness, but sometimes it can lead to more serious complications like we'll hear about in Stan's case. Not everybody will even have symptoms when they have hepatitis A, but some can include tiredness, stomach pain, fever. And the telltale sign is a yellowing of the skin and the eyes, and that is often accompanied by darkly colored urine. So if you can be evaluated.
Okay, well, thank you. Go on. I just have something else you wanted to add, Doctor?
I did. Yeah, no. I did want to add, and there have been over 42,000 cases reported nationwide. And in fact, right now, there are 24 states that are actively experiencing an outbreak. And so that just really increases the risk of transmission to the general public. So I'm very glad that you're talking about this topic with your audience here on the eve of Liver Awareness Month in October.
Well, and let's speak with our hero now. And Stan, you're a hero. You're out there in the world with a concern that you acquired, I guess, here, and are dealing with, and open enough and care enough about others to speak about it. So tell us a little bit about how you got involved with
Thanks, Paul. First, I want to thank GSK for sponsoring me and helping me share my story. The way I got involved with was contracting hepatitis A. It just came all of a sudden. I was 65 years old. I was in the best shape of my life. I had just completed a half marathon and everything was going great. I was really enjoying retirement. After eating out, feelings of nausea on a daily basis. I didn't have any other symptoms like Dr. talked about jaundice, yellowing of the skin, but because it was coming and going so often, I figured something is wrong. So I went to my family doctor, and when I went to see him, then he sent me to the emergency room. Lo and behold, my liver was failing. Miraculously, I was able to get a liver transplant, as it turned out, within a day of after having been diagnosed. That saved my life, or I wouldn't be here talking to you today at all. Life after that has been very hard. I'm 4 years into it, and we still have some issues to resolve. But I keep a positive attitude and have made my way back to a healthy and active lifestyle. And I'm here telling the story because I don't want other people to have to go through what I went through. If there was a vaccination that I know available, I certainly would have got it, but I didn't. And so because of that lack of knowledge, I have to pay the price. So here we are today, 4 years later, and we're still taking a handful of pills just to stay alive.
Oh my God. Did you had no liver, like fatty liver or any other concern prior?
No, there were no concerns. I was really healthy. I mean, we went through all kind of 5Ks, and we went through, I think, several half marathons. I mean, I was in great shape. And then all of a sudden this hits you, boom.
So, doctor, maybe you can tell. I mean, this is like long lasting. I mean, you have a bout and you go to the hospital, and a liver transplant, I think, is a miracle. This is somebody else's liver. Is that what a liver transplant is?
Yes, that is what a liver transplant is. And I do want to I want to point out that Stan's case is uncommon, right? For most people, it is a short-term illness, but like serious complications. So we're really glad that Stan mounted a recovery from his infection.
So what do you suggest? I mean, I know the hepatitis A shots, and I know actually vaccines and shots are more readily available nowadays.
Yes.
You see a list of different concerns, vaccines that you need to, I guess, pay attention to. Speak to your doctor. Is that what you're saying?
So I do want to, before we talk about the vaccine, I just want to talk a little bit about how it's spread, because that really will impact who we think is affected by hepatitis A, right? So it can be spread person to person or through contaminated food and drink, as in Stan's case. So anyone can really be at risk for hepatitis A. Not only people in high-risk groups like people who use drugs, both injectable or non-injectable, people who are experiencing homelessness, or men who have sex with men. And for 30% of cases, there's no identifiable risk factor, right, at all. So it's for that reason that the CDC says that any adult who wishes to be vaccinated against hepatitis A can be, regardless of any risk factor or whether or not you're traveling to an area where hepatitis A is common. And like you said, the vaccine is readily available, but unfortunately, only 15% of US adults have received at least one of the 2 doses that are required for long-term protection. So that means that 85% awareness month starts in October. Now is the perfect time to talk to your pharmacist or your healthcare provider, not only about hepatitis A vaccine, but about any CDC recommended vaccine that's appropriate for your age.
And I've done quite a few stories on liver problems. I have a fatty liver myself. Am I more prone to hepatitis A? And a lot of people have fatty livers. No?
Not that I'm aware of. So there are many different types of hepatitis. And so you bring up a good point. There are many different types of diseases or conditions that can lead to an inflammation of the liver. But hepatitis A is a viral condition. So it's spread either person to person, like we talked about, or through contaminated food or drink. So that's what sets hepatitis A apart, and it's a short-term illness versus some other forms of hepatitis that might be more chronic or long-term.
When we hear about a food recall, pay real serious attention to it. Is that possibly a way to get hepatitis?
No, a food recall is separate from a hepatitis A outbreak, and I'll explain how that might be different. So hepatitis is a food handler, right? Not necessarily the food itself. Yes. So if a food handler is working in a restaurant and they maybe unknowingly have hepatitis A and they don't practice proper hand hygiene, so washing their hands before handling food, that's how hepatitis A can be spread through food and drink.
Thank you very much. Stan, any other closing thoughts here? And then also maybe we have a website we can send people to, but Stan, our hero here. Any other thoughts?
Just talk to your doctor about getting the vaccination, about hepatitis A vaccination. You don't want to have to go through what I'm going through. That's why I'm here today trying to tell my story. It's really easy to get the vaccination. So if at all possible, and if it's right for you, and get it so that you can protect yourself and your loved ones. That would be the final story.
Okay.
Yeah.
All right. And Doctor, with any website? and places we should go to learn more?
Exactly. For additional information, your audience can go to cdc.gov/hepatitis.
Okay. All right. Thank both and stay well. Thank you.
Thank you.
Thank you.
Bye bye.